Now the world faces another global health crisis. The monkeypox outbreak has escalated, forcing the World Health Organization to declare a global emergency. But how did we get here? And what does this mean for you? Monkeypox is no longer a rare disease limited to isolated regions. It's spreading worldwide. In just months, cases have surged in Europe, the Americas, and even parts of Asia. With thousands infected, the outbreak is fueling a public health crisis that the WHO says requires immediate attention. So, what exactly is monkeypox, and why is it causing such alarm? Monkeypox is a viral zoonotic disease, meaning it can jump from animals to humans. It's caused by the monkeypox virus, a relative of smallpox. But don't be fooled. While less deadly than smallpox, it's still a serious illness. The symptoms? Fever, headaches, muscle aches, and a characteristic rash that turns into painful blisters. Sound familiar? These symptoms overlap with other diseases, making monkeypox diagnosis tricky, and that's part of the problem. The outbreak began in regions where monkeypox was already endemic, like Central and West Africa. But unlike before, the virus has now breached borders, spreading through close contact, contaminated surfaces, and respiratory droplets. Experts warn, monkeypox transmission is escalating faster than public health systems can handle. This is why the World Health Organization recently declared monkeypox a global emergency. But what does that mean? It signals that international coordination is now critical to stop the spread. It also unlocks funding for research, vaccine development, and global public health measures. Thankfully, there's some good news. Vaccines originally designed for smallpox, like the Jynneos vaccine, are effective against monkeypox. Governments are rolling out vaccine campaigns, but challenges remain, especially for countries struggling to access enough doses. And prevention? It starts with awareness. Avoid close contact with infected individuals, maintain hygiene, and report any suspicious symptoms immediately. But why is this happening now? Could the virus have mutated? Or is it our increased global connectivity that's fueling this outbreak? Epidemiologists are studying the monkeypox virus closely, and while mutations have been found, there's no solid evidence of increased virulence, yet. Countries like the United States, Brazil, Spain, and India have reported alarming case numbers. This outbreak is pushing healthcare systems to their limits. Monkeypox epidemiology shows that high-risk groups, including immunocompromised individuals and healthcare workers, are particularly vulnerable. But here's the question on everyone's mind. Could monkeypox become the next pandemic? Experts argue it's unlikely, but not impossible. Unlike COVID-19, monkeypox isn't airborne and spreads primarily through close physical contact. Still, complacency isn't an option. The global monkeypox outbreak is a reminder that public health is a shared responsibility. While the situation is serious, it's not hopeless. With vaccines, public awareness, and international cooperation, we can control the spread. Want to know more about monkeypox symptoms, treatment, and how you can protect yourself? Subscribe to our channel and hit the bell icon for the latest updates on this global health crisis.